What is depression? Understanding the symptoms of depression. What is depression? In modern times, the word depressed has become somewhat synonymous with feeling sad or down. But in reality, depression is a serious condition that can have significant impacts on a person's mental and physical health. Hi, I'm Melissa Hummelt, LPCC, a licensed therapist with BetterHelp. If you suspect you may be living with depression, knowing how you're feeling can be challenging. So in this video, we'll define depression and go over its symptoms, along with what causes depression, how to know if you're depressed, why and how to screen for depression, and potential treatment options that can help. First, let's do a quick overview of depression. What is depression and what are its symptoms? Depression, which can also be called major depressive disorder or clinical depression, is a mental health condition that can cause a persistent low mood, which may feel like prolonged sadness or apathy. It can affect the way you think and act, potentially leading you to be disinterested in things that once excited you, pessimistic about your future, or just generally unhappy. According to the Diagnostic and Statistical Manual of Mental Disorders, or DSM-5, there are various symptoms that can lead to a depression diagnosis, including depressed mood, loss of interest or pleasure in daily activities, feeling worthless, excessive or inappropriate guilt, decreased concentration, significant changes in weight or appetite, sleep challenges, significant changes in physical or mental activities, fatigue, and thoughts of death or suicide. If you're experiencing suicidal thoughts, please contact the Suicide and Crisis Lifeline immediately by dialing 988. What causes depression? Now that we've defined what depression can look like, let's take a step back to discuss what may cause depression. Like other mental illnesses, there is no singular cause of depression. Factors that can increase an individual's risk of developing depression include brain chemistry, family history of mental illness, past trauma, and the presence of another behavioral health condition, such as an anxiety disorder, eating disorders, and substance use disorder. In particular, substance use and mental illness often co-occur, as some people might use substances to cope with the symptoms of depression. According to the U.S. Department of Health and Human Services, 1 in 4 adults with serious mental illness also has a substance use disorder. How do you know if you're depressed? If you're experiencing some of these symptoms, how do you know if what you're feeling is depression? Temporary feelings of sadness can be normal, and many people have them. But prolonged low mood can signify a more serious concern, like major depressive disorder. And depression that persists for weeks and affects how you work and interact with others may benefit from professional support. Major depression is the leading cause of disability for people in the United States between the ages of 18 to 44. And clinical depression is common globally, with over 280 million adults diagnosed worldwide. However, treatment is highly effective for depression, and it can help you manage symptoms and improve your well-being. What is the value of depression screenings? If your symptoms indicate you might have depression, it can be essential to know early on to prevent dangerous symptoms. One way to determine whether what you're experiencing is depression is by taking a depression screening test. A depression screening test can validate your experiences by acknowledging that you might be living with a mental health condition. It can also help raise self-awareness, giving you insights into how your mood is affecting you. And depending on the results of your test, it may help you gain the confidence to reach out for professional support. Test results can be helpful in a clinical depression evaluation as well. If you take a test and are prompted to follow up with a mental health provider, you can bring the test results to your appointment to discuss the questions and your responses. What do depression screenings entail? Depression screenings often group depression symptoms into 3 areas. Emotional symptoms, which may include the feelings you've been experiencing. Somatic symptoms, which typically involve your physical sensations. And other psychological symptoms, such as thoughts and behaviors. Several tests have been developed to assess whether someone is living with depression. They might be administered online with traditional pen and paper or interview style with a qualified professional. What are depression self-assessments? Self-assessments, such as those you might find online or download and print from a trusted source, is a preliminary option for those seeking information about depression. These tests are not a substitute for professional help, but they can help you understand whether it might be beneficial to reach out for support. One of the most reputable screening tests for depression is the Mental Health America Depression Test, which is linked in the description. This test utilizes the Patient Health Questionnaire 9-question test, also known as the PHQ-9, which has proven reliable in determining the presence and severity of depression. This test is short, but many professionals give it to patients to fill out before their medical appointments. Other depression screenings that are commonly self-administered include the Zung Self-Rating Depression Scale, which is a short 20-question test that rates depressive elements using various I statements. The Major Depression Inventory, or MDI, which is typically used by professionals in diagnosing clinical depression, but can also be taken online independently before appointments. The Edinburgh Postnatal Depression Test, which evaluates symptoms of postpartum depression after having or adopting a child. And the Geriatric Depression Scale, which is designed for older adults whose depression symptoms may present differently than those of younger adults. Online versions of each of these screenings are available in the description. However, remember that these screenings do not replace professional diagnosis, and to discuss any results with a qualified professional to determine your next steps. What are professionally administered depression screenings? If your self-assessment test leads you to seek help from a behavioral health specialist, they may take you through another, more comprehensive test. These tests are often done interview style and are scored precisely and used as part of making a formal diagnosis. Examples of professional depression screenings include the Hamilton Depression Rating Scale, which includes 21 questions, and the Montgomery-Åsberg Depression Rating Scale, which evaluates all 3 types of depression symptoms and rates each item by severity. How do you treat depression? If you're experiencing depression, know that there are many treatments available that can help to improve your symptoms and allow you to live a happier, healthier life. Evidence-based treatment options for depression include psychotherapy, medication, and support groups. Cognitive behavioral therapy, or CBT, is a popular form of psychotherapy for depression, focusing on challenging your unhelpful thought patterns to change the way you think and behave. This treatment is flexible and can be available in multiple formats, including online through platforms like BetterHelp. What are some healthy methods you've used to improve symptoms of depression? If this video gave you any helpful insights, remember to like, subscribe, and turn on notifications for additional tips. And if you'd like to learn more about how cognitive behavioral therapy can treat depression, check out our video on the topic. Depression can be challenging, but you don't have to face it alone. If you're looking to better understand your symptoms, it can be helpful to take a screening test to see whether you might be living with depression. After taking a test, or if you want a more professional outlook, consider contacting a licensed therapist for guidance and support. By watching this video, you've already taken the first step, so thanks for being here. Take care, remember to subscribe, and we'll see you next time.